Now we'll move into the next issue, which we'll be discussing an overview on it and get to list out all the examples under this. So we're looking at the soft tissue infections. Okay, soft tissue infections. So the most important aspect of this is list the examples. After we're done, later on we'll still look at the examples one by one. So soft tissue infections, we say that they are just infections and they involve the skin, subcutaneous tissue, fascia and muscle, and they could be mild or they could be life-threatening. So it's just invasion of bacteria. Now most commonly you are dealing with bacteria like the Staphylococcus aureus and the Streptococcus pyogenes. So it could be from cuts, it could be from abrasions, it could be from insect bites, it could be from surgical wounds, it could be from burns, it could be from diabetic ulcers, So usually affect the skin on top, the skin underneath, the subcutaneous fat, the fascia, and also muscles are affected. So what are the different examples? Just like what I've been seeing in these images, we have cellulitis. So it's a diffuse bacterial infection of the skin, subcutaneous tissue. You can pause to look at the common signs, right? Then we have the Erysipelas. This is Erysipelas. Superficial infection involving the upper dermis and superficial lymphatics, with more clearly delineated borders compared to cellulitis. So cellulitis is more of like widespread. So abscess is when there's now pus collection. Impetigo, superficial skin infection, mostly in children. Then we have the necrotizing fasciitis, which is a rapidly spreading infection of the fascia and muscles. Okay. So generally, risk factors could be that the person has diabetes or a poor blood circulation, and the person is immunosuppressed. Your immune system is weak. Maybe there's trauma or surgery or a poor hygiene. So clinical features is generally as associated with all infections. The place is red, is warm, swelling, tenderness, pus discharge. Okay, you're feeling fever, chills, malaise, rapid progression, tissue death. Okay, so you usually manage them if it is most of the times it's bacterial infection. So antibiotics are the mainstay. So amoxicillin, clavulanate, then also the cefalexin. Okay, so abscesses you could actually incise and drain, okay, which is very important to take it out. Okay.